Welcome back to Unique Adolescent Minds Unlocked. We're talking about the teenage brain, and let's be honest, it's complicated. Let's start with a quick moment of confessions. Hands up if you know a teen who can hyper-focus on video games for 6 hours straight, but can't remember to hand in a major project. Oh, I know those hands are raised out there. But hands up if you've ever sat down to do one important task, write an email, do homework, complete chores, and somehow 45 minutes later, you find yourself 3 years deep into celebrity Instagram feeds or watching YouTube videos. We have to be honest, we all get lost in the scroll hole. We all experience distractions. But for the adolescent brain grappling with ADHD, that momentary distraction isn't a minor detour. It can feel like a complete, unavoidable brain hijack. These teens are often brilliant, capable, and insightful, yet they struggle daily with the invisible roadblock of executive function. Today, we're bridging the gap between normal teenage distraction and the real structural challenges of adolescent ADHD. We're cutting through the confusion and moving beyond the idea of just buckle down and focus. Dr. Du was with us. So let's get ready to move from frustration to effective strategy. Let's dive in. Hello, Dr. Du.
Hi.
How are you? Can you introduce yourself to our listeners for today?
Certainly. I am Dr. Rachel Du. I'm an MD, and I work in child psychiatry here at Duke. I have sort of unofficially, clinically, and research specialized in ADHD, and it's my favorite thing to talk about and think about and treat.
Perfect. The episode today is dedicated to empowering the partnerships between the parents, the teachers, and the counselors. And we want to give them language to understand what's happening, the science behind the struggle, and actionable tools that they can do to create an environment that focuses on the win in dealing with ADHD. So it's one of the most common yet most understood diagnoses in adolescent mental health. It looks very different in a restless 8-year-old versus a forgetful 15-year-old. Let's actually get to the basics. Dr. Du, what is ADHD, and how does this presentation typically shift from childhood into the adolescent years?
ADHD is just a term we use to apply to the syndrome of people who have persistent patterns of difficulty with attention, hyperactivity, and impulse control that have been there throughout their life. That doesn't mean the symptoms aren't fluid, and they change over time as well as in different settings. For a lot of people, the hyperactivity that is very apparent in a toddler or an elementary school student has started to abate by junior high or high school. Or the patient may have just started to find it kind of embarrassing and started learning how to control it better. So I've had people tell me that they will just pretend they need to go to the bathroom in class so that they can get up and move, or they may even skip class because it's so important to them and difficult for them to stay seated for a whole hour. You might find them destroying a pen instead of jumping around, or they may be having thoughts that have nothing to do with what you're doing, but still look like they're paying attention.
Yeah. For years, the statistics have shown that there could be a clear gender gap. Boys are diagnosed with ADHD at a rate at least 2 to 3 times higher than girls. This disparity leads me to ask you, are boys more susceptible, or are we missing ADHD in girls because the symptoms manifest differently?
This is a difficult concept. It's sort of circular reasoning. The fact is that when the criteria for ADHD were developed, the sample population was male. So if we're saying that girls have a different presentation, we're essentially saying this is a different disease. I think that girls are socialized to cover up their hyperactivity and impulse control a lot more than boys. One thing that has been noted in literature lately is that girls tend to have more social drama when they get into middle and high school, which can lead to a lot of depression and even suicidal ideation.
Okay. ADHD is often a problem of doing what you know, not knowing what you do at times. The ability to plan, prioritize, self-regulate falls under a crucial skill set, executive function. We need to explore what role does executive function deficits play in the daily challenges that a teenager face with ADHD.
The executive in our brain is the one who decides what is the long-term goal that we want to achieve at any moment and what are the steps related to it. For example, completing an entire project instead of switching after a couple of minutes to something else. This is very challenging for ADHD patients because their brains seem to focus more on immediate results than longer-term results. So this might look like not completing a work or actually doing the work and then forgetting to put it back in their backpack and getting a 0 because they didn't turn it in. Having a conversation with somebody about something you feel strongly about and finding yourself talking so loudly that the person thinks that you're angry and feels threatened. Blurting out comments that hurt other people's feelings that you didn't mean at all. Chronic lateness. Sometimes it can look like just taking a very, very long time to tell a story.
Yeah. And so I can see how like the frustration can build up that's associated with some of the symptoms of ADHD, not just from like the daily challenges, but from the simple fact that so many people misunderstand what ADHD truly is. We know that these myths can sometimes sabotage a teenager's self-esteem and prevent them from getting the right support that they actually need, not only at school, but also at home. What are the biggest misconceptions about ADHD that you have encountered when speaking to parents, teachers, or school administrations?
One is that that it's a lack of information, and if these children are just given skills and told skills over and over again, there's no reason why they can't be doing it. Therefore, it must be volitional or on purpose. I'm not saying that you can't develop skills as you get older, but if that was going to work, it would have worked before anybody got diagnosed because they would, it's not like nobody ever told them do this or don't do that before they get to my office. And they want to do well, but they're just not picking up the skills at the same rate as their peers, and that's kind of the whole point. Now, telling them what to do over and over again is often embarrassing. It doesn't fix anything, and it makes them feel like you think that they're stupid. So it's really kind of counterproductive in a lot of cases.
Yeah. So it sounds like a big thing is like people, parents, or teachers may feel you're doing this on purpose, and it calls you just to repeat over and over again. But in actuality, they're not doing it on purpose, and it can sometimes then stigmatize them or make them feel worse than how they're presenting in the beginning.
Yeah, one of my big aha moments when I started treating ADHD is when I met kids that went to math class, completely understood the lesson, did the assignment perfectly, and then got a 0 because it was wadded up in their backpack. And then you hear people say, well, he's just being selfish. He only cares about himself. And I said, well, this is actually not behavior that benefits him in any way.
Right.
It's completely independent of what any normal person would want to happen to them.
Absolutely, because if you did the work, you want to at least get the credit and some benefit from that. In adolescence, sometimes the stakes are raised, like academic pressure becomes higher, social dynamics are complex, executive functions demands continue to increase. When a teen starts to struggle, simply saying try harder, like you talked about, can be very, very damaging. It can even sometimes have an underlying mental issue, and we can't afford to miss some of those signs. So let's identify them. For parents and teachers, what are the key academic and behavioral red flags that indicate a teen might be struggling with more than typical adolescent growing pains?
Well, when it comes down to it, and this is true of a lot of areas of child psychiatry, we want to look at what is actually happening. Is the person staying on their normal developmental trajectory? Symptoms like inattention and anger and anxiety are problematic by themselves, but the major issue with them is that they lead to avoidance, which can really ruin your life. So if somebody gives in to not going someplace because of anxiety, they may never go anyplace again, and that's really the problem. With an ADHD child, if they learn their ABCs a year or two after their peers, it really isn't the problem. That's not that big of a deal. Mm-hmm. The problem is that after they have experienced this, they lose their motivation and they start avoiding things. So you can't expect necessarily your teenager to love high school, but if they start skipping school or refusing to go, that's when we want to treat it because that's interfering with their normal function.
Yeah, so it sounds like you're saying that when it starts to interfere with them actually growing and becoming who they want to be, successful in life, that's when more should be a concern about this is not just a regular adolescent problem. This may be leading to more something else like ADHD.
Yes.
I can see how that even may facilitate or fall over into other things. So can you quickly explain how does like poor time management, even the organization, and sometimes even the procrastinations are ADHD symptoms?
So these are all very typical symptoms. As I mentioned before, it seems that the ADHD brain prioritizes its current interest over its future needs. Which, of course, evolutionarily, if in some cases, is perfectly appropriate and beneficial, but not really in high school. It's just harder for them to take some unpleasant steps because you're keeping in mind that you're going to get a greater reward later. Procrastination gets worse over time because of that loss of motivation that I was mentioning. After they've tried and been told they're not trying, you've sort of uncoupled the concepts of work and success for them. And it's natural for them to start to want to avoid that situation by not even trying.
Yeah, absolutely. And like you mentioned, the core symptoms, like when most people think about ADHD, they think about the inattention and the hyperactivity. But the greatest struggle for teens often happen outside of the classroom, affecting their inner lives and their social world. That constant push and pull of the disorder can quietly erode their self-worth or their self-esteem, especially with how they facilitate friendships. We need to shed light on these hidden challenges for our youth. In addition to the core symptoms, what are some of the less obvious ways that ADHD could affect an adolescent, such as their peer relationships, emotional regulation, or their self-esteem?
One of the worst parts of ADHD isn't even in the title, and that's the impulse control symptoms. Yeah. And they get missed a lot. Sometimes I call it ADHD foot and mouth disease because it makes people speak without thinking, and they're always accidentally offending people, even like people they really care about, their closest friends. And their friends' feelings get hurt. They try to understand, but they're all kids, so hearing those kind of things is hurtful. Also, ADHD people frequently have kind of a hair-trigger temper. They'll get very upset about things that later they don't even understand why they cared about. But before they get to that stage, they've already said a lot of hurtful things to their parents or their friends, and they will apologize, but the damage is done. So these two processes of offending people and losing control of their temper kind of are part of the continuous process that leads to low self-esteem. And once they've got that causes further impairments. You might find a kid like this hanging out with peers that get them in trouble, or a girl dating a boy who treats her very badly because they're very desperate for friends and they feel like they need to take whatever they can get.
Yeah. So it sounds like it's a lot of the impulse decisions at that time that can be verbal and they don't mean it. They just say it. How does a teen or how do you adequately tell the parents or even their friends about ways to expect this and how should they handle that when those come up?
Well, I often get to communicate with the parents and explain that this is involuntary, that they don't mean to do it, that they love them very much no matter what they say in the heat of the moment. But it's really hard for people to keep that in mind, and sometimes these arguments can get really quite terrible. With teenage friends, it's hard to know what to do other than spreading education about what ADHD is and giving the kids explanation they can offer.
Yeah, absolutely. When we talk about ADHD, we often talk more about just a single diagnosis. In fact, the majority of adolescents with ADHD is what we call like a comorbid condition. It occurs with other mental health challenges. This is where the diagnosis becomes like an art. It's not really a checklist because sometimes the symptoms can overlap or look exactly alike. If we were to treat one without treating the other, the teens most likely will continue to struggle. So, given that ADHD often occurs with other mental health challenges, what are the most common co-occurring conditions that you see, and how do you use that to influence the diagnosis or the treatment?
Statistically, I most often am going to see kids who also meet criteria for anxiety or depression or both. And the big question for me then becomes what came first? There are people who were just genetically predisposed to have anxiety and ADHD, but it's more common that the anxiety has developed as a result of the ADHD as well as depression. After we can treat the ADHD, they start to have better experiences and they stop having that expectation that everything is going to go wrong and they're going to mess everything up, and they can get a lot better. So it's really a missed opportunity when people think that they can't treat ADHD because the medications might cause anxiety, for example. So usually that gets better. Substance abuse is also very common. And typically I see people with ADHD turning to alcohol or cannabis as an escape from this world where they're constantly hearing that they're a disappointment, that they're unintelligent, that they're rude, that they're selfish. But if we can get that person treated and they start having normal experiences, they won't need that escape anymore. Yeah. So it's also very much related.
Yeah. And I'm glad you brought up even more riskier behaviors such as substance use, because that leads me to my next thought. You know, we talked a lot about like the poor self-esteem and the daily life activities, but sometimes with untreated ADHD, they can engage in more riskier behavior or risk-taking behaviors that have long-term consequences. What is the link between untreated ADHD and adolescents in risky behaviors such as like driving issues or the substance use issues that you just brought up?
Well, there are many links. The adolescent brain in general is all grown up in terms of motor function, and abstract thought is pretty good too, but their ability to predict long-term outcomes and think things through is really not there yet. I was a pretty anxious teenager, but I vividly remember sliding down our hill in my car on the ice and then going, wow, that was fun. Not thinking about the fact that I could have gone right into the road and been hit and died. So if you have ADHD, this is much worse. Another phenomenon is that kids will start to learn that they can talk the ADHD kid into doing really ridiculous things. And because the kids are so desperate for friends, they're very vulnerable to peer pressure and get themselves into terrible situations for others' amusement, unfortunately.
Yeah. And I think that's something that's missed a lot, especially with the ADHD population, that desire to have friendships. So maybe even engaging in other activities that they normally wouldn't because that is a strong tie that they need at that moment. We talked about the executive struggles, some of the hidden emotional toll, the risk-taking behaviors. That leads my audience to maybe ask the question, like, what works as a psychiatrist, right? When a family receives an ADHD diagnosis for their teenager, what is the best approach that they should be taking? What is considered the gold standard for comprehensive ADHD treatment in adolescents?
So there are different practice parameters, but they all have some things in common. And I generally conceptualize ADHD treatment as having three pillars, which are school accommodations, home accommodations, and medication. And these aren't either or. They all work together as a stool to support that kid. You can't just give medication and not talk to the kid about what's going on because they're not going to want to take the medication for very long. The school accommodations may not be useful if the child's not on medication. They may get extra time for tests, but actually be the kid that rushes through and gets done before everybody else. And then the most important thing is at home, teaching parents how to use positive reinforcement all the time and as much as possible to make up for all the negative feedback these kids have gotten, several times an hour since they were 3 years old sometimes.
Yeah. And focusing on the medication piece, because we're both sitting here as psychiatrists, but it could be a crucial part, like you talked about, of the ADHD plan. What should parents know about the efficacy and potential side effects of stimulants versus non-stimulants?
So stimulants is kind of an unfortunate title. What's really being stimulated are the brakes. So the part of the brain that is affected by stimulant medication is the prefrontal cortex, which is the part of us that makes us human and able to plan. This is underactive in ADHD, and the stimulation causes enhanced neurotransmission, which normalizes their ability to plan and think temporarily. Unfortunately, it has kind of a scary title that makes people think that we want to shoot electricity into their child or something. Non-stimulants also have been proven, if they have FDA approval, to be better than placebo for ADHD, and they're perfectly acceptable. However, the efficacy of the stimulant treatments is roughly twice that of non-stimulants. And there are other advantages, such as the ability to take breaks. If you're on a non-stimulant, you need to maintain a steady blood level, so no weekend breaks, no summer breaks. But a stimulant can be given only on school days if that makes everybody feel more comfortable.
Can you talk about some of the side effects that parents, teachers should be looking out for when it comes to using a stimulant for their adolescents with ADHD?
The most common side effect I see is appetite reduction. This can be really disturbing to parents of a little kid that's always been picky, but by the time we get to the teenage years, it's not so much of a big deal, and we can work around it pretty well. Most people, if they have appetite suppression with their daytime stimulant, can just eat a bigger breakfast and eat extra in the evening and end up with the same amount of calories they would have had otherwise. In extreme cases, we might use supplements or give them those weekend breaks to make up the calories. However, I think as a mother, I know that there's a drive in you that's inbred to want to see the kid eating all the time because in olden times, they could starve to death if you weren't paying attention to that. And so most of my time with this side effect is giving reassurance to the family and problem solving rather than de-prescribing anything. Secondly, there can be a delay in the onset of sleep, which is also not a deal breaker. We can just give them something that doesn't last as long. And this isn't even something that you always see. I've got a lot of adult patients who, when they get treated, their sleep gets so much better because they actually get to bed instead of, fiddling with this and that until 4 a.m.
Yeah, absolutely. So the big things that you want listeners to take away is the eating, the appetite suppression, and sometimes it can affect the sleep, which can be managed with your psychiatrist or whoever's prescribing for you to combat those side effects.
And non-stimulants also have side effects. They're frequently very sedating, which also can be dealt with. Sometimes they do affect mood negatively, but the important difference is that the stimulants are just more effective, so we try to use those if we can.
Yeah. Beyond medication, so what type of psychotherapy or counseling is available or most effective for teenagers with ADHD, like cognitive behavior therapy or organization skills that can help out?
So as a person gets into the teenage years, they're getting better at being able to think of themselves as a person and observe and predict their own behavior. An adult is able to look at a piece of paper and say, I better put this somewhere safe because I've lost it the last 500 times this happened. But a little kid does not have that self-observation. And teenagers are kind of in the middle. So definitely organizational skills training is worth trying, but it's not going to supplant the need for medication. And behavioral therapy and organizational skills training can go very nicely together for teenagers and adults, because there are a lot of things that everybody does as far as writing stuff down, using Outlook and a calendar and stuff like that, that you'll find the ADHD people don't do at all. They may have stopped using lists in fourth grade because they lost it every time and it just was more trouble than it was worth. But when we get them on medication, they can really make use of all the systems that everybody else is using.
Yeah. So it sounds like what you're saying is that we need a combination of all of these together to get our teenagers or adolescents to a place that they can actually succeed and feel self-efficient. Not medications alone at time, not therapy alone, but together a blend about meeting the needs of your youth.
Right, because again, they're not doing it on purpose. And if you take them in a quiet room and talk to them about what needs to happen, they'll likely tell you exactly what they should have done. But their brain is just not functioning the same way in the moment.
For an adult, managing their health conditions can be a personal choice. So it is a personal choice. For a teenager, a treatment plan can feel like just another set of rules being imposed by their parents or authority figures. However, we know that successful outcomes in adolescents, especially with ADHD treatment, almost always relies on a collaboration or a shift in dynamics where they feel like they're a part of the team and a part of the decision making. How do you as a clinician ensure that it is important for teams to be partners in their treatment plan? And how do you encourage their buy-in?
Well, as a child psychiatrist, I am subject to the suspicion of all my new patients that I've been hired by their parents to turn them into the kid that their parents really wanted, which is very, not a fun thing to think at all. So I have to cooperate with the parents and their concerns, but also get across to the kid that they are the customer and that their needs are what we're meeting for. I have an extraordinary number of 13-year-old boys who come in and the parents say that he's decided he wants to stop his medication. And often they'll come up with some reason, I feel funny, I don't like it, my appetite, something like that. But I think really what's at the bottom of that is that at that age, they start to think, this is an insult, that you're giving me this medication because you don't like me just the way I am. And you think that I can't do it on my own. And it feels bad. So they want to push back against that. So it takes a while, but we need to, try to get across to them that we like them fine. This is only treatment to help their lives be easier.
And I know this is kind of on the spot, but what is kind of your spiel or your conversation during that moment to say, hey, I get it, right? People want you to behave differently. They want you to show up differently, but this is important to your overall success. And kids or teenagers feeling like, okay, you sold me, I'll continue the medication.
I have a couple different spiels. One is that I tell a make-believe story of a classroom back in caveman days where everybody's paying attention to the teacher except for the people with ADHD. They're hearing all the different noises in the jungle, and they're the ones who notice that a saber-toothed tiger is about to come and attack the classroom. Everybody else is concentrating very well, so they get eaten. And in that situation, having the ADHD brain is absolutely the best one and the one that everybody would want to have. That is not the circumstance that this kid is living in when they're in America in 21st century school. But it's a matter of fit, not of value. They're not crazy. They just have a different type of brain. Another way to conceptualize the medication is to try to let them see it as a tool. I'll say, what if there was a pro golfer that we gave clubs that were for a preschooler? Nobody would be able to tell that that person was good. They wouldn't be able to show their skills until they got the proper equipment. Mm-hmm. And the medication is the equipment that goes with your brain.
Yeah, I like that. It's kind of turning it differently. Here is the scenario or the environment that you need to be in. Let's say if we didn't treat your ADHD, you'll be great. You'll survive. You'll live on for the next generations, right? But then here's the scenario where it doesn't work and we want you right now to live in reality and we want to set you up for success. So I really, really love that. How can parents effectively support their teens with homework or long-term projects without micromanaging or feeling like they're coming down or talking down to their youth?
Teenagers want to start having independence, but they may not be ready for it. However, one of the worst things that happen is this constant nagging all evening. Did you do your homework yet? Did you do your homework yet? It's not very long before people are like, it'd be really nice if I didn't have homework. And so they just start lying, and it's just kind of adaptive behavior to them at that point. So I tell my parents that they still need support, but that we need to set up some systems that are not just you telling the kid that they're doing something wrong. We need to use positive reinforcement as much as possible. I tell them to get a little pill box to have the medicine in, and then go check and see if the kid remembered to take it, instead of just telling them over and over again, go take your medicine, go take your medicine. Because all those negative interactions hurt their relationship and make the kids want to avoid the whole issue.
Yeah, I like that. For a teenager who is already struggling maybe with self-doubt or social comparison, especially with an ADHD diagnosis like you talked about a lot, can feel like a judgment, not a discovery of myself. And the parents using language is crucial about how do we positively reinforce, and not feel like we're nagging. How should parents approach the topic of ADHD with their teenagers in a way that is validating and promotes self-advocacy?
Well, I often talk about the benefits of the ADHD brain. And, a lot of people have skills that they'll be able to exercise freely once they get through school. I've met little boys that I thought, you were born to sell cars, but you're not going to have a choice of jobs if we don't get you through the 6th grade.
Yeah.
So this is all an investment in your future. And I also talk about, what would the world be like without them? Imagine if everybody carefully considered all the risks before they did anything. Would we have ever had an American Revolution? Would we ever have had a civil rights movement? No, we would probably all be enslaved. So these are important traits that are not abnormal. They just need specialized to certain situations.
Yeah. Funnel it in a way that is useful at those times, and then package it away and put it away when it's not as useful at those moments. I love that. If you had to narrow it down to the most essential, most impactful things that parents or teachers could start today to help their teens with managing their routines or responsibilities or living their emotional lives, what would it be?
I've never had a teenager that thought that they were getting enough credit for the stuff they were doing right. This is very common that they feel they only hear about what they messed up. The parent may feel like they're giving praise all the time, but it doesn't feel like that to the kid. The point of a reward system is for the person to get the reward. And so these need to be designed so that the person can be getting small wins throughout the day. And the system needs to be changed so that the kid, is able to learn how to do a new thing and then move on to the next challenge, and that they're going to keep interested. Also, a common problem is, say you're using rewards, but you have made the task too challenging, and there's no partial credit for trying. It's like if you were playing pinball and there was a hole and the ball just kept falling out. It wouldn't be very motivated to keep trying because you knew you were never going to win.
Yeah.
And so that's the kind of situation where the kid doesn't want to do the reward system, and the parents tell them that they just don't care about anything.
Yeah. We talked a lot about what parents can do, and I just want to flip it to some of our educators that may be listening. How can teachers or the school counselors work together to facilitate a better environment for our children with ADHD, some of the organization skills that you talked about, or even time management that can help them in the moment while in classrooms?
Well, my mom was a teacher, and I remember having people call our house to complain to her when their kids got bad grades when I was little. So I can totally feel for them. And the fact is that these teachers, especially in high school, have 7 different class periods with 30 kids each, and a lot of times they don't really know who has an IEP and what the conditions are. So we really depend on the EC staff to be a bridge between the parent and the teachers. The teachers, have different levels of understanding of ADHD. They have their own feelings about the diagnosis, just like everybody else on earth, and they've been told that they have to do this or that. Sometimes without being consulted, which is not a situation that makes people want to cooperate very well. So that EC staff needs to be an educator and to not set up a blame game between the parents and the teachers.
Yeah, absolutely. And you as a psychiatrist, what is the most important, or what are the most important long-term outcomes that you hope to achieve with successful treatment of ADHD?
My hope for every single one of my patients is that we can get them through high school and college with their motivation and self-esteem intact. If we can do that, then they don't have to do things that they don't want to do anymore. You have so much more control as an adult over how you spend your time. If you have a choice of jobs, you can pick the one where you don't have to be on time, or the one where you don't have to sit still. But all of those things are contingent on getting through school. So I talk to parents as this is an investment in your child's future. We're going to give them the choice as an adult to spend their time the way they want to. And maybe they will decide they want to be a philosophy professor and read all day, and they do stay on medication, but maybe they won't. It'll be up to them at that point.
Yeah, absolutely. And I can see like there's so many moving parts, especially with having an adolescent with ADHD. You have the teacher's perspective of what's going on. You have the parent's perspective of what's happening. Then if they do have a psychiatrist or a mental health provider, they're helping them along the way. What is your advice about creating a seamless communication loop between the psychiatrist, the school, and the parents to ensure a unified approach to support the teen?
This is a problem that is not going to go away. There have been various research groups over the years that have tried to come up with systems to make this happen, but the fact that there are privacy regulations that the school is nervous about means that it is pretty big ask to have direct communication between the doctor and the teacher. And even if there were, the parent needs to hear all that information anyway. So what I do is I coach the parents on what I need to know. So the teachers may have thought that you judge whether a medication's working, yes or no, but I want to know when it's working, what time of day it's working. So I coach the parents on this is the information I need from them, and then they will bring that back.
Yeah, it's like creating that intermediate person, the collaborator in the middle, to then take the direct questions that you need to inform your decisions on the medication back to the teacher, who's probably seeing the majority of the time when the medications are wearing off or when the medications are working, coming back to you to then further support the teen. Dr. Du, this has been a lot of information about ADHD, and I'm glad that we have your psychiatrist perspective, because soon we'll be hearing from the therapist side of things and how they manage ADHD and what is their approach to it. Is there anything that you want our listeners to take away from today?
I guess that when a kid feels like they can't be successful, their really only defense is to stop caring. I try to get this across to parents in various ways by saying, I'm not a very good tennis player, but I don't sit around and worry about it, and I don't go out and practice because I know that I'm never going to be good at it. Yeah. So I stop caring. And if I knew that I was going to be terrible at math, it would be pretty hard for me to keep enthusiastically engaging in math for 20 years because people said it was important.
Yeah.
And so that motivation and that investment in what they're doing is not voluntary and is every bit completely related to the ADHD.
Yeah. So it sounds like, although a child can be diagnosed, or teenager diagnosed with ADHD, it really takes on our part to look at them holistically and not just identify them by this label, because we could be subconsciously reinforcing already those negative self-thoughts about themselves or their ability to do that can predict their future.
Absolutely. It's completely natural for someone to not put effort into something that they've been told that they're not going to be good at.
Yeah. Thank you so much, Dr. Du. I really appreciate you coming today to speak about ADHD, and I really hope our listeners took away a lot of jewels that they can use in the future to further support our teens with this.
Thanks for having me.
No problem.